Americans speak out. The high cost and access issues in U.S. healthcare. The American healthcare system is broken, and it's time we face the music. The rising costs, lack of reimbursement, and unsustainable shortfalls are threatening the very foundation of our emergency response system. It's not just about numbers. It's about the lives of our emergency responders and the communities they serve. A recent industry report revealed that ambulance services are under-reimbursed by an average of $1,526 per transport, with Medicare alone paying nearly $2,334 less than the cost incurred. This is a ticking time bomb, and it's only a matter of time before our emergency responders are no longer able to stay on the road. But here's where it gets controversial. The reimbursement crisis is not just a matter of numbers, it's a matter of policy. We need to elevate the voice of ambulance agencies themselves, so lawmakers and insurers understand that fair payment isn't a bonus. It's essential to keep us safe. Take, for example, the story of Kevin Bond, a 60-year-old self-employed individual living with congestive heart failure. His ejection fraction is dangerously low, and the Affordable Care Act is the reason he can see a doctor, take his medication, and stay alive. But if Congress doesn't extend the ACA's enhanced subsidies by August, his $30 premium could jump to over $800. That's over 25 times as much. This is not just a matter of policy, it's a matter of human lives. And it's not just Kevin's story. Millions of Americans are quietly panicking, walking the same tightrope. These policy changes aren't just math, they're about the lives of our loved ones. But what's even more alarming is the comparison between American healthcare costs and those of the European Union and Switzerland. In France, the private price for the MMR vaccine is around $13, while in Switzerland, it costs under $40. In the U.S., the cost of the measles vaccine can be as high as $1,400. Something is very off in the USA, and it's not that complicated. We need to take a closer look at our healthcare system and ask ourselves, what's going on? Why are we paying so much more for the same services? And this is the part most people miss, the profit of commercial insurance carriers. In my experience, folks don't notice that their primary insurance has changed to Medicare primarily because their employer is still deducting the premium for their commercial group health insurance. Isn't it fraud for the insurance carrier to collect premiums for a policy for which the subscriber is visibly no longer eligible by law? The financial incentive for commercial carriers not to tell subscribers that their coverage has ended is staggering. They can collect high premiums, then decline to pay benefits. And it's not just the insurance carriers. Hospitals also have a financial incentive to perform procedures on patients who are 65 or older and still on a commercial plan. But here's the thing. We can't just sit back and watch as our healthcare system crumbles. We need to take action, and we need to take it now. We need to invest in public health infrastructure, from the federal government as well as state, territorial, local, and tribal governments. We need to strengthen our public health systems, both infrastructure and technology, as the foundation and path to keep America healthy. And we need to start thinking about preventive care, not just post-injury treatment. Physical therapy, for example, has been shown to reduce fall risk, cut emergency room visits, hospitalizations, and opioid use among older adults. It's time to shift the policy spotlight upstream and incorporate physical therapy into primary and preventive care. So, what can we do? We can start by supporting and passing the bipartisan Stopping Addiction in Falls for the Elderly, or SAFE Act. This common-sense legislation would allow Medicare beneficiaries to access no-cost falls risk assessments from the fall prevention experts, physical and occupational therapists. We can also start by holding our lawmakers accountable for their actions. We need to ask them, what are you doing to address the reimbursement crisis? What are you doing to invest in public health infrastructure? What are you doing to promote preventive care? The American healthcare system is broken, but it's not too late to fix it. We just need to take a closer look, ask the right questions, and demand action from our lawmakers. The lives of our loved ones depend on it. Senate hearing on Trump's Medicaid cuts, impact on healthcare costs access. Imagine a situation where one hand gives and the other takes, creating a paradox in the realm of healthcare policy. This Thursday morning, the Senate Health Committee is convening to explore strategies for reducing healthcare costs, a critical issue affecting millions of Americans. The timing of this hearing is particularly noteworthy, coming just weeks after President Trump signed what he termed a big, beautiful bill into law. This comprehensive legislation includes sweeping changes to Medicaid, the largest reforms since its inception in the 1960s, along with over $1 trillion in reductions from various federal health programs. Leading the charge against these measures is Senator Bernie Sanders, representative from Vermont. The ranking member of the committee, Sanders has vocally opposed the Republican-led spending and tax package, warning that the cuts could have dire consequences. He argues, thousands and thousands of low-income and working people will die as a result of these policies. But here's where it gets controversial. While some see the bill as a necessary step towards fiscal responsibility, others view it as a potentially lethal blow to the safety net that supports vulnerable populations. The hearing, set to start at 10 a.m. Eastern Daylight, promises to delve into these complex issues, offering a platform for both supporters and critics to voice their concerns. And this is the part most people miss. The real impact of such policies often lies in the details, which can be difficult to parse without a deep understanding of the healthcare system. So, what do you think? Is the bill a step forward or a step back? Share your thoughts in the comments below. How competition transparency can fix America's $5 trillion healthcare crisis. Navigating the high costs of healthcare, the need for competitive practices and greater transparency. Introduction. The exorbitant costs associated with healthcare in the United States have become a pressing concern for those in positions of authority. Current expenditures in the healthcare sector approach a staggering $5 trillion annually, with federal financial allocations comprising approximately $1.9 trillion, or an alarming 27% of the total federal budget. Publicly funded programs, such as Medicare and Medicaid, not only significantly burden the federal budget, but also contribute to the country's long-term fiscal instability. Moreover, in the commercial health insurance market, where around 153 million individuals receive their coverage, rising expenses lead to increasingly higher premiums, which affect both workers and their employers. To put this in perspective, the annual cost of a family plan under employer-sponsored insurance has now climbed to over $25,000. This figure is striking when compared to the median household income of roughly $80,000 and has a detrimental effect on wage growth and overall employment stability. Therefore, there is considerable potential for positive outcomes if we can successfully slow the increase in healthcare spending. Not only could this improve the long-term fiscal health of our nation, but it could also lead to enhanced wage growth for employees, reduced out-of-pocket expenses, and the freeing up of resources for other important policy initiatives. However, it's essential to clarify that this call for moderation is not an endorsement of indiscriminate cuts to healthcare funding. A significant portion of what we spend on healthcare is invested in services and products that offer considerable value. Reducing expenditures in these crucial areas may endanger public welfare. Instead, we should focus on developing policies that specifically target sectors where the correlation between spending and achieved value is particularly unstable. Eager to dive deeper? Read the full testimony here. Testimony link: https://wp content uploads 2025-07 Equitable Help Testimony PDF X8509. And here's where it gets interesting. Are we truly prepared to scrutinize which healthcare expenses deliver genuine value? As we navigate these complex waters, what steps should we take to ensure that our healthcare system meets both fiscal goals and the needs of the populace? Your thoughts on this could ignite a meaningful conversation in the comments section.